So you work with a variety of scents and oils. Do you ever sell any with the claim of it helping the customer become smarter after or during use?
Smarter.
Yes.
Now there's a very interesting question. I haven't been asked that question before. But yes, I have seen some literature that would allow me to say that if I wanted to promote that concept. Are you familiar with the plant rosemary? I mean, it's used in cooking, right? So you're going to put rosemary sprigs on lamb and things like that. Well, many, many years ago, Shakespeare, in terms of traditional and folkloric types of usage, which is one type of usage for integrative techniques, actually described how rosemary helped with memory. So if you're talking about making you smarter, is memory considered making you smarter?
Sure. Yeah.
So improving your memory with rosemary. So there is oil, essential oil of rosemary from the plant, and you can use that oil in a way to help learning and help your memory. And it's actually specific chemicals that most recently have been identified and published in literature. The cinolols in rosemary are what they found were the most active in helping the brain actually function better.
In our experiment, we were basically testing to see if there was a connection between the placebo effect and aromatherapy, like the aromatherapy that just candles or something that has no known reason to make you smarter, but if you tell the patient it will make them smarter and they smell it, then it's the placebo effect and it will make them smarter.
I understand what you're describing. Another term for that is state-dependent learning, and that's been described in the learning literature. State-dependent learning means that you basically are convincing yourself that while you're studying, while you're doing times tables or whatever it may be, that as you smell lemon or spearmint, that will help trigger memories. And then when you get into a testing situation and you have the same scent again, lemon or spearmint, it will help trigger what you've memorized in the past. So there's ways of saying, okay, is it really purely a placebo effect, or is it really where you are actually using the power of the mind and convincing yourself that something works? I mean, it's all about believing, and whether you believe it works or don't believe it works. I like to think the placebo effect is extremely real, and that when I meet a patient and I say, we're going to go to surgery now, would you like something that will help you not be nauseated afterwards? And they say yes. I offer them an oil. Now right there I have gotten them to consider that this would be helpful for them. And it's a way of taking the mind and having it believe in something. Now if that's operating a placebo effect and using oil of ginger in the palm and having them smell it so that they are not nauseated afterwards, then I would go for the placebo effect to help somebody, yeah.
Yeah, that's great. And then, so do you think any scents would actually work with the power of the placebo effect? Like you said, rosemary, ginger spearmint.
I think that there's not a literature for many scents that would imply that you could do that. Research hasn't been done along those lines, but I think that the power of the mind is so strong that you can pretty much take whatever scent, whether it's lemon or lemonade, and take the mind and get that activity, that special believing activity in its function, yes.
In the future, could aromatherapy become a more conventional way to treat patients with dementia, or could more uses be discovered?
Absolutely, many more uses can be discovered. I think that the field of integrative medicine, of which aromatherapy is a small portion of it, is growing by leaps and bounds right now. And many people are becoming more aware of it. There are many hospitals throughout the United States and the world that are using aromatherapy in the hospital setting for healing people. And you know, the very specific ideas that you can take one oil for one thing is I think a limiting factor. I think you can take many oils for many things. What I've been promoting locally here in the valley is using ginger and lavender together, because lavender is very relaxing. It works as if I'm giving an intravenous sedative to the patient. Works on the very same receptors in the brain. GABA receptors is what they're called, gamma-aminobutyric acid, and they get relaxed. There's definite studies to show the brain waves soften, that they get less spike in waves, and that they become more relaxed. And their parasympathetic tone increases, and their sympathetic stimulation decreases. So the autonomic nervous system can be activated or diminished using essential oils. And the ginger, when you combine it in a perioperative sense, no nausea, because it calms gut tissue, stomach, so they don't feel sick with their stomach action. So there are different ways of going about it. I like to think that things are becoming more and more mainstream, and there's much better science than there was even this century, this decade, than the last one.
Absolutely. In our science fair project, we did something like you said, combining, what did you combine, guys?
Ginger and lavender.
Right. We combined jasmine,
eucalyptus. We had just many different scents that we melted together in a tart, but that didn't have anything having to do with making the patient smarter to have better results on a test.
We just wanted to mix a scent together that was kind of sterile, relaxing, but kind of earthy, because we use this one called Autumn. But we wanted to make sure that they couldn't recognize it. Otherwise, they'd be like, oh well, if this is jasmine, then it's just jasmine. It can't help me on this test.
And so we had to present it. We dressed up in lab coats, and we tried to present it like it would really help them on the test, because there's studies showing that how the placebo effect works. It's better if a doctor presents it. But then we looked at our data, and there wasn't a correlation between the placebo effect. We did a nocebo group and a placebo group, so we did one with the negative effects, telling them they would do worse on the test with the scent. But everything had pretty much the same percentage, and there wasn't a correlation.
Well, as you found out, it's very difficult to do an aromatherapy study.
Yeah.
Because how do you cover up a scent when it's a scent?
Yeah.
And so everybody knows it's coming before you're even there. I think it's what you alluded to earlier, though, where you're actually taking a specific problem like dementia, Alzheimer's. These areas, there is very clinical positive research showing that oils can be very effective. The Australians have published a study where they actually had it in an old people's home where there was a great deal of dementia. And they sit around in groups, and they're supposed to be social, but one form of dementia is angry dementia, rude dementia. And they found that by putting people in contact with the oils, maybe putting drops in a little heart-shaped pledget on their lapel they could smell, that everybody in the group functioned socially better. And overall, the center actually saved money because they could take them off some of the really intense medications that they were on to control behavior. Because many of them are on really psychotropic medications to help them, be more socially acceptable in group and in general in the home.
So if we discover a connection between how to really use aromatherapy and make it a more conventional medicine, do you think it would reduce healthcare costs by a lot in the United States?
I definitely think, this study in particular that I mentioned in the nursing home, they save money in their formulary. Drugs are very expensive. And oils, good quality oils, are also expensive. But overall, the difference between one prescription and one oil, there's a definite imbalance in terms of cost. Oils are cheaper and have much less risk of side effects. And they've been proven to be safe and effective, in many ways more so than medications, because you can have very paradoxical results with medications, over-sedation, under-sedation, and the risk of drug interactions and side effects starts to multiply when you see older people on a dozen different medications. So the risk is definitely there. The benefit of using oils is quite remarkable, because oils are definitely much easier to use, much safer to use, but it still requires a great deal of education for it to become more mainstream in clinical settings.
So do you think more education would make aromatherapy more conventional in the medical world?
That's a very challenging point. I mean, I've done many, many lectures to nurses and physicians, and I'm finding that the nurses are very, very in tune and willing to learn more and wanting to put things into practice in terms of aromatherapy. I'm finding that physicians are too busy to be bothered with it, frankly. They don't want to read about it, they don't want to hear about it, because they're really wrapped up in their own clinical skills and the clinical trials that they're doing themselves. So I think there is a difference between who you're trying to educate and who's in charge. If I could mention one more thing, nurses now in Arizona are allowed to use what's called a NANDA diagnosis. They're allowed to take, when they meet a patient, they can say, hey, you're suffering from nausea, and they can go to the medicines cabinet and take essential oils and take them to the patient and treat them with essential oils. They don't need a doctor's order to do it. So I think that's a major breakthrough that I'm finding more and more in the hospitals here in the Valley, where nurses are actually the forerunners, actually doing the care at the grassroots level, and doctors are just doing what they're doing, doctoring.
Interesting. So physicians are a little more stubborn, while nurses are more accepting to the new concept.
You know, you use the word stubborn. I wondered if I can agree with that. And yeah, I think in some regards, with some people, yes, I can agree with that.
Or they're doubting of the concept.
Well, they're just very cautious. I mean, because it's been a very difficult thing trying to find good literature that's convincing. In the last century, you know, in the 90s, the literature was very equivocal. It was like, no more studies need to be done. It helped with some symptoms in some people sometimes. That's not very convincing. It's hardly worth the effort, it would seem. And that's why I'm so excited about the new literature that I'm seeing published in the last few years.
Do you think aromatherapy works better if the patient really believes it will work, other than them just smelling it and then seeing the effects of it later?
Essential oils and aromatherapy are classified by the Federal Drug Administration, the FDA, as food. Many people are not aware of it. And they're in our food. They're in our food chain extensively. It's used as flavoring and fragrance in much of our foods. So to describe it as purely a medicine isn't really adequate. And on the other hand, the FDA also says you're not allowed to make medical claims about things. So that's part of the rub in this day and time, where people are saying, okay, it's good for memory, it's good for pain, it's good for nausea. So are you allowed to take traditional diagnoses and folkloric treatments from the past and translate them into modern times and work on those? Yes, you can. But to actually say that it cures cancer, no. But in the Petri dish, it's very interesting because there have been many good studies to show that oil of frankincense, oil of thyme, works in the Petri dish to kill specific cancer cell lines. Yeah, as we spoke about it initially, was the placebo effect. And attitude is everything. There's been a recent study about the vital signs in spa workers that was done in Taiwan, and it's now rocketing around the web, where they put spa workers, males and females, in a small room and diffused with a vaporizer the scent of bergamot essential oil, which is a citrus oil. And within the first hour, their blood pressure and their heart rate both decreased. In the second hour, their heart rate and blood pressure started to rise. Well, it's not statistically significant, it was just barely any little number. But when you read these stories on the web, depending on who is the author of how they took this information, they can say very positive that aromatherapy of bergamot oil lowers your blood pressure. And then the other one is, don't breathe essential oils too long because it will raise your blood pressure.